This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Coping with Stress and Anxiety During the Pandemic and is sponsored by Bove Industries. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can with time allotted once the presentation concludes. Your questions will remain anonymous. Today's presenter is Marie O'Brien. Marie is an adult health nurse practitioner and the coordinator for the Integrative Pain Management Program at Mather Hospital. She's an active member of the American Society for Pain Management Nursing and member of the Consortium for Nurse-Led Care. In her current position, Marie and her team seek to expand the use of holistic and integrative modalities to address not only the physical aspect of pain, but address the psychosocial, emotional, and spiritual aspects as well. Marie, you can go ahead and get us started.
Thank you. Okay, are we good?
Perfect.
Okay, awesome. So welcome everyone to HealthyU. I appreciate your time as we share the next hour together. I know that you just did hear the Mather Hospital disclaimer, and I always will put out my own disclaimer. This information presented and reviewed is not intended to substitute for medical expertise and advice of your healthcare provider. We do encourage you to discuss any decision about treatment or care with your own healthcare provider. And the mention of any product, service, or therapy does not provide an endorsement. So we are all going through COVID-19 together. And, you know, it's a big challenge because as we're going through this infection, we have to recognize that the public health crisis of COVID-19 is really greater than just the risk of infection. And I'm sure many of you have probably picked up on that, you know, especially with all of the challenges that this infection has put on every one of us as a society. The Center for Disease Control, American Medical Association, American Psychiatric Association, National Institute of Health, American Nurses Association, all of these organizations recognize that although many of the things that have been put in place to help us deal with COVID are there for our safety and our overall well-being, there are some challenges related to that. And right now, we are all going through an incredibly stressful and unique situation, right? This is one that we have never had to face before. Most likely, it's one that we may have been expected to be over by now. And we may all feel as if we're in this perpetual state of fight or flight. Our bodies are always raring to deal with the next challenge, and that's not always very healthy. So that's why we're going to discuss the challenges of stress and anxiety, you know, related to the pandemic. Things right now may feel uncertain or unpredictable, and like we really have very little control over them. And it is perfectly understandable that this really brings with it a roller coaster of mixed emotions, as well as many challenges and concerns. You might be feeling scared, worried, maybe a lot more than usual, feeling stressed. You might feel down or maybe anxious. You might be feeling a little more irritable than usual, or maybe getting angry at things that maybe you were never angry about before. You might be feeling a little judgy towards your friends, neighbors, or coworkers. We may experience a number of these different emotions or feelings day, one day and something different the next day. Or you may even find that you're experiencing a change in your emotion and feelings hour to hour. You may feel fine 1 minute, and the next minute you might be completely overwhelmed. And I would like to reassure each and every one of you that emotions like these are normal. These are a normal response to an abnormal situation and really to be expected. We don't like it, but it really is to be expected. Our emotions really help us to respond to and face situations in our lives. That's why we feel emotion. And so it's very important to be compassionate to ourselves and those around us, to really experience that sense of compassion, to recognize that as we're experiencing still elements of isolation, social distancing, the changes to the way in which we go to work or go to school, all of these things have really been disruptions to our normal routine. And this has really been compounded by ever-changing messages and directives that we might hear from all different levels. And none of this is from any malice intent, but because things are so rapidly changing. We're getting new and different information each and every day, and that causes a sense of stress. So be kind to yourselves and be kind to those around you. So recognizing that all of these different impacts, they're affecting our mood, and they can lead us to feeling stressed, anxious, or low. And then that in turn can lead us to feeling even more isolated. So as we go over things in our mind, and that might even lead us to feeling more anxious, and that becomes a vicious cycle. And that then leads to frustration, sometimes maybe hopelessness. So we know that this is overwhelming. And sometimes it's really hard to know what you can do to manage how you're feeling, as well as maybe what to recommend to your friends or family or coworkers, to help with these feelings. So that's the reason that we're here sharing this information with you today at HealthyU. So we're going to discuss the concept of self-care. And self-care really is that action that we take for ourselves in putting on our own oxygen mask. If you've been on an airplane, maybe you haven't been on one lately, but the last time that you were on a plane, when they say in case of a loss of cabin pressure, put on your own oxygen mask first. And sometimes that's really difficult to do because most people have a tendency to try and help the person closest to them first. And then they want to help the people around them first. And typically we leave ourselves to last. But if you don't take care of yourself first, then it makes it very challenging to take care of others. So that's why we're here to really discuss what you can do for self-care and how to help with some of the stress that you may be feeling. So what exactly is stress? It sounds like such a negative term, but stress is the body's natural response to feeling under any threat or pressure. Stress can actually be a good thing at times. It can be motivating for short periods of time, like if you were going to talk on a HealthyU seminar, a little bit of stress helps to make sure that you get your PowerPoint done and that you look at what you're going to say to make sure it's all done properly. A little bit of stress helps if maybe you have something physically taxing to do. Maybe you have a long day ahead of you and you have a lot of errands to run. So you might feel a little bit of stress or pressure. And that little bit of stress triggers our body to activate our sympathetic nervous system. And it allows us to garner up all of our internal resources. Such as our hormones, and it gets our nervous system ready to engage in whatever we need to do. The challenge is that when we're in this fight or flight response for a longer period of time, So if your body is under that fight or flight stressor for a day, a week, a month, a year and a half, then that is really where we need to be concerned, because our bodies are not meant to be under that amount of taxing stress for so long. And that then can become very overwhelming and unpleasant. In addition, having that amount of stress taxing our sympathetic or fight or flight response for a long period of time can impact our immune system, and it prevents our immune system from working at its optimal level. And during a time of a pandemic, we really want to make sure that our immune system is ready and engaged and doing its best to help protect us. So there are some things that you can do to help reduce your stress and help keep your immune system functioning at its best. There's a number of things that you can do to help your body manage stress from the inside out. And along with following all of the practical advice and guidelines that we've been given from our leadership, from local to national, like social distancing when appropriate, and washing our hands, and all of the things that we do to keep ourselves safe and protected from COVID. If we're able to mitigate our stress and allow our bodies to be as healthful as possible, we can really keep ourselves protected. So we're going to talk about some stress reduction techniques that you can use for yourself, as well as those people that you love and care about. We need to recognize that our stress response occurs when stress or stressful thoughts pass through the filter of our mind, and then they result in a response from the body. So we think about something that might be stressful, and then those thoughts are filtered through our mind, and our body becomes prepared to do what it needs to do to address that stress. Chronic stress really is one of the biggest drivers of chronic conditions. So as you can see from the slide that I have up, so this is from the Center of Disease Control talking about stress. And the statistics are a little bit on the dated side, but it really just goes to show you that this is not just a challenge that we're facing right here and now, but it's a challenge that has been occurring for quite some time. And many of the chronic conditions that we experience, coronary artery disease, diabetes, autoimmune diseases, many of these chronic diseases are either caused or made worse by chronic stress. And not only is it taxing on us, but it's also taxing on our economy. It costs a lot of, it takes a lot of financial resources to help address the impact of stress. And when we look at what stress can actually do to the body, you can really recognize that it impacts our entire body. So when we're feeling overly stressed, it can give us headaches. We might feel dizzy. It makes us irritable or angry. Sometimes people will experience panic attacks. We might notice that our jaw is kind of tight, and maybe we wake up in the morning and we were grinding our teeth, or we feel a lot of tension in our jaw, or people who maybe experience TMJ. A lot of that is related to stress. You may notice an increase in your heart rate. Stress can impact anyone who has coronary artery disease. It can make hypertension and diabetes worse. We can feel stress in our GI system, a lot of digestive disorders, upset stomach, abdominal pain, irritable bowel syndrome is escalated by stress. It has a big impact on weight gain and obesity. So stress really has a big impact overall. Not to mention the challenge that we've really been seeing, especially lately, with the impact of COVID and the stress that it's been laying on so many people. The increase in alcohol use, drug addiction, tobacco addiction, and the rate of suicide. So all of these things are really problematic, not only for the individual, but also for our society as a whole. So we need to recognize first and foremost that stress is not bad. We need stress. Stress is important to allow us to respond when we have a threat or pressure. We know that it's motivating, but when it becomes a challenge and we're overwhelmed by stress, that is really when it's problematic. Now, there is a fine line between stress and anxiety. Both are emotional responses, but stress is typically caused by an external trigger. And the trigger can be short-term, such as a work deadline, speaking at a HealthyU seminar, maybe a fight that you might have had with someone that you care for, or it may be a little bit more long-term, such as being unable to work or a chronic condition. People who are under stress can experience mental and physical symptoms. So these might include irritability, anger, fatigue, muscle pain, digestive troubles, or difficulty sleeping. Anxiety, on the other hand, is defined by persistent, excessive worries that don't go away, even in the absence of a stressor. And anxiety can lead to nearly an identical set of symptoms that you would see in stress. So people who suffer from anxiety will have trouble sleeping, or they'll have difficulty concentrating. They may feel fatigue or muscle tension or irritability. And so we want to point out that if your stress or anxiety does not respond to some of the things that we're going to talk about today, or if you feel that either stress or anxiety are affecting your day-to-day functioning or your mood, please really consider talking to your mental health professional or your primary care doctor, and make sure that perhaps there are some other additional coping tools that might be helpful for you. Don't feel like you need to suffer in silence. So there's lots of ways to manage your stress. So we're going to go through some practical steps to help manage your stress and reduce the risk of those negative health effects that we've just been talking about. So first and foremost is to observe yourself. Really recognizing the signs of your body's response to stress, such as difficulty sleeping. Perhaps you notice that maybe you might feel like you need additional alcohol or other substances. Maybe you're feeling more easily angered, or you're feeling more depressed, or have a real decrease in your amount of energy. Perhaps you're normally a get up and go person and you never take a nap, and you feel like you have enough energy to get from the time you wake up in the morning until the time you go to bed. But lately you're just not having that same level of energy. That's really awesome that you're able to recognize what's happening in your body. You know better than anyone else knows you. And learning to observe and recognize both when you feel good as well as when you're feeling tense or stressed, that's really the first step to reducing the impact of stress. So being in connection between your mind and your body, and observing yourself and noting when you feel stressed, and more importantly, when you don't feel stressed. You know, it's hard to know what something feels like if you haven't had the opposite. We can't really truly know what happiness is if we haven't felt sadness. We can't really know what pain is unless we've been, you can't really know what comfort is unless you've experienced pain. So being able to recognize what's normal and also what's abnormal is really the first step to tackling some of these challenges. Now, one of the best ways to be observant is to explore the concept of mindfulness. So there's a lot of discussion about mindfulness in the literature and all over. You can pick up any magazine at the grocery store, and there'll be some discussion about mindfulness. So we want to point out that mindful and what is mindful and what is your mind is just full. So there is a difference. So when we are mindful, it's not that our mind is so full of information. That's actually the opposite. So very often we're feeling like our minds have so many competing priorities that it becomes very challenging to focus on what's happening in your body. So when we're mindful, as opposed to our mind being so full, we're able to think about the here and now. So it's really being on that cusp of the present moment. And the present moment is gone in a fleeting moment, right? A minute ago is the past, and a minute forward is the future. So when we're mindful, we are in the present moment, just recognizing and appreciating what's happening in the here and now. We're not judgmental, and we're able to just focus on what's happening in the moment. And that's really the premise behind mindful, where we're not thinking about everything that's happened in the past, what happened yesterday, what someone said to us last week. We're not worried about the future, about a deadline that we might have, or about what may happen if X, Y, or Z does or does not happen. Because when we're worried about yesterday or perseverating over what may happen in the future, that really is very challenging for our physical body. And of course, that can't be helped, right? We're always going to think about or maybe review in our minds what happened this morning or what happened yesterday, because that will help us maybe plan, or thinking about the future. We plan for the future. But being able to take small segments of time throughout your day to just be in the present moment can be extremely helpful for enhancing your resilience to stress. And the first step to doing that, the first step or exercise to being in the present moment, is just to breathe. And it seems like such a simple task, so simple that how could it possibly be helpful, right? We were born knowing how to breathe. Everyone knows how to breathe. But mindful breathing is different than just rote breathing, right? So we're all going to breathe. Unless we hold our breaths, we're all going to continue to breathe. But being able to focus on our breath will allow our bodies to feel much more calm and in the moment. So when we breathe, changes in our body can affect our breath. Changes in our mind can affect our breathing. Changes in our breathing can affect our body. And changes in your breathing can affect your mind. So what do I mean by that? That sounds very convoluted, but it really is very, very simple. So if something is happening in your body, say you're about to give a presentation, or maybe you're going to run a race or do something strenuous, well, that's going to change your body. You need more oxygen, right? So if your body needs more oxygen, your body will automatically breathe deeper and faster. So a change in your body will affect your breathing. You may breathe faster if you need more oxygen. Changes in your mind affect your breathing. So if you focus on something that's calm and positive, right? So if you sit for a moment and check in with your breathing, see if you're breathing very fast, or maybe you're breathing a little more slowly. Check in where you're at and just pay attention to your breath, and notice that if you think about something positive or happy or calm, your breath will automatically slow down. It's just natural physiology. And changes in your breathing can affect your body. So if you slow your breathing down on purpose, so in a mindful way, focus on breathing a little bit more slowly. Focus on maybe controlling the rate that you breathe in versus the rate that you breathe out. You can notice that your heart rate will slow down a little bit. You can notice that your body feels more calm. And in turn, to close that loop, changes in your breathing can then affect your mind. So it's all very connected. So the diagram that you see on the screen, breathing in and breathing out, it's just a tool. And there's lots of tools like that on the internet. So I found that just doing a Google search for breathing. They call it a GIF, G-I-F. And if you look under images, you can find images such as that to help you follow along with your breathing. There's also quite a few apps that have tools like this to help us pace our breathing. And in pacing our breathing, we can see a profound impact on our physiology, on our heart rate, on our mood, and our thoughts, just by breathing. Another few tidbits of information to recognize is that when you do take a deep breath, we call it a diaphragmatic breath, where your diaphragm drops, that actually triggers your vagus nerve. Now that sounds really complicated. What is the vagus nerve? The vagus nerve is connected to that fight or flight response, and it allows us to turn down like a knob on a radio station, turn down that response so that you feel more calm. So if you took about a minute to take deep breaths, and let's practice now. Hopefully you're all in a safe, controlled place. Maybe you're at a desk, maybe you're in your kitchen. Even if you are listening to this on your phone and you're driving in the car, you can breathe and still focus on what you're doing. So if you're driving in a car or doing something dangerous, I'm going to ask that you not close your eyes. But if you are someplace safe, you can, and it's comfortable for you, you can close your eyes. And if you take a deep breath in through your nose, breathing in through your nose, and imagine that the air is filling down into the bases of your lungs. And if you place your hands on your belly, if you're able, and notice that a deep breath where the air fills down into your lungs can cause your belly to expand a little bit. And that's a real deep breath. Sometimes when we breathe, if you take a deep breath, I'm just going to ask you to notice if you take a deep breath and your shoulders come up. You know, sometimes people take a deep breath and the air is just filling the top part of their lungs and their shoulders come up a little bit as they take a breath. That's not the type of breathing that I'm talking about. I'm talking about a nice deep breath where your shoulders are dropped, your diaphragm drops, and your belly expands a little bit. And that's the kind of breath that can allow you to have control over that fight or flight response, which is so powerful because no matter where you are, you have the power to impact your body and your physiology just through breathing. If you're on the line at the grocery store, you're driving a car, you're maybe a little frustrated with your kids or your parents or a coworker, everyone can take a breath or a couple of breaths and notice that change. So I'm just going to challenge you moving forward to take notice of your breath as you move through your day. And just a couple of times per day, it can be extremely valuable. So here's another exercise. This is called a take 5. Now with a take 5, it's the same breathing that we were just talking about, except you can use your hand as a tool. And so when you use your hand as a tool, right? Yes, that is my hand in the picture. You take one hand. So if you're right-handed, open up your left hand and vice versa. And you can take your pointer finger from your dominant hand. And as you breathe, you're going to trace. You're going to start at your palm. And as you breathe in all the way and apply some pressure. So I'm going to ask you to follow along. As you push down on your hand, a little bit of pressure, just to feel the pressure. So it shouldn't be like you're pushing so hard that it hurts, but just some gentle pressure so that you can feel it going up the sides of your finger. When you get to the top of your thumb, a little press down. Now there's pressure points on your hands. So if you've heard of reflexology or acupressure, there are acupressure or reflexology points all over your hand. So as you breathe in, a little pressure going up your thumb. When you get to the top of your thumb, push down and then exhale and trace it back down to the base of your hand. Breathe in, going up to the top of your pointer finger. When you get to the top, press down and then exhale, coming back down your palm. And again, you're going to repeat that gesture, breathing in, pressing down, breathing out, pressing down, breathing in, and press down. And then exhale, coming back down, and then back up to your pinky, press down, and then follow it back. This practice takes, maybe a minute. And it can allow you to focus. Sometimes it's very challenging for people to do a mindfulness exercise or engage in anything that's mindful. And even just the idea of focusing on your breathing alone can be a bit challenging. So being able to have this tool that's with you all the time allows you to focus on your breathing, as well as give yourself a little bit of a massage to your hand, which is also very calming and can allow you to feel more centered and focused. And if you have time, you can switch and do the other hand as well. We use this with patients in the hospital, and they find that it's very calming and very helpful. So meditation is another excellent tool to help us be more focused, as well as help mitigate or decrease a lot of stress that we're feeling. And there's a lot of great reasons to meditate. Meditation allows us to understand our emotions. It's been documented to lower stress, allow us to connect with other people a little bit better, as well as connect with ourselves. It improves our ability to focus, and it helps reduce all that chatter that goes on in our brains. And, sometimes it is a lot simpler than most people might think. There's a number of different steps that you can do to start to meditate. And I do challenge you to give it a try. There's a lot of really good apps on, available in the App Store or the Play Store. And many times it's just a matter of finding something that resonates with you, that you feel is speaking to you and that you can do. But the simplest way to even start doing a meditation practice is to start doing a meditation practice. It's like the first step to a long journey is to take that first step. The first step to doing any of these types of interventions is to just jump in and do it. So a couple of pointers to get started: just taking a seat someplace that's calm and quiet for you, setting a timer. So for many people, 1, 2, or 5 minutes is a great start. You can start with just 1 minute, and 1 minute is better than no minutes. And you may find that after a couple of days of doing a meditation practice for 1 minute, you may feel confident to then do 2 or 5 minutes. And then you may find that that's enjoyable and that's helpful, and you can escalate at your own pace. As you're doing it, as you're sitting in a quiet, calm place, you're just going to notice your body, notice how you're sitting, whether you're sitting or standing or lying down. You're just going to notice about your body. Notice what's happening in your body and begin to focus on your breath or your breathing. So the breathing exercises that we were just talking about, that deep diaphragmatic or belly breath where your diaphragm is dropping and your belly is expanding, focusing on that breathing just for a minute or two. As you focus, you're going to take notice. What does it feel like when you're breathing? Is the air hot or cold? Is it comfortable to breathe? Notice the air going in through your nose and going down into your lungs, and then vice versa. What does it feel like as the air comes back out? Now, it's very common, especially when people start to meditate, they find that their brain goes someplace else and it starts to wander. We start to think about all the other things that are going on in our lives, what happened yesterday, what's going to happen tomorrow. And I urge you to just notice and be kind to yourself. Do not judge yourself. It's very often that people who try to meditate will say, I am a terrible meditator, or my mind keeps going someplace else. I can't do this. And I want to tell you that you can do this. You have it within you to be able to do this. And when you notice that your mind is going someplace else, just check in with yourself and say, oh, goodness, my mind is not in the present. That's okay. Let's come back to the present and continue your practice. And just like we would tell our kids when they fall off of their bicycle as they're learning to ride a two-wheeler, get back on, get back into your breathing and your focus and move forward, because it's okay to stumble. So don't judge yourself. And when you're done, remember to take a deep breath and then say thank you to yourself. Be kind to yourself. And that is all there is to it. So it really is a very simple practice, but they call it a practice because it needs to be, let me think, practiced, right? Now, this is another technique. We call this a body scan meditation. So this is very similar to what we were just talking about. A body scan meditation allows you to focus in the present and connect with your body. And this is really very simple to do. And there are a lot of great apps that can help with body scan meditation. The VA health system actually has a great free app that's available on the Google Play Store or the App Store, and it's hidden within an app called CBTI, or Cognitive Behavioral Therapy for Insomnia. Because body scan meditation or progressive muscle relaxation is actually an evidence-based practice to help with sleep. And so being able to use this intervention when you're trying to go to sleep at night can really help you fall asleep faster and get more restorative sleep. So if you have trouble doing this on your own, there is an app that will, within that app, it will walk you through doing this. But in essence, body scan or progressive muscle relaxation goes on the premise that you cannot be tense and relaxed at the same time. So if you take your hand, right? So I'm going to challenge you, take your hand and turn it into a fist. And as you have your hand in a fist, it's definitely not relaxed, right? It's very tense. So now I'm going to ask you to open it up and just let it be relaxed. Let it wiggle a little bit, kind of flop. In that floppy, relaxed state, there is no tension. So we cannot be tense and relaxed at the same time. Sometimes it's very challenging to know what it feels like to be relaxed. So if I were to say to you, I want you to go to bed and just relax, that can be very challenging for people. So doing this type of exercise allows you to go through your body, one body part at a time, and feel tension. And then notice the difference between the tension and when you relax that tension to feel relaxed. So you could start with the top of your head or your forehead or your eyes. So if you tense up your eyes, and I know I look really funny if you're looking at me doing that. So I hope you're following along so that you don't have to look at me looking funny. But if you tense up your eyes, notice the tension as you tense them up and hold for maybe 5 or 10 seconds and then relax and notice what it feels like. And you're going to do that all the way down your body. So starting with your head, tense up your forehead, your eyes, your jaw, tense up your shoulders, your arms and your hands, and you're just going to run down, tensing and relaxing each body part for 5 to 10 seconds, going all the way down your body to your feet. Or vice versa. You can start at your feet if you think that's easier. Tense your feet, relax your feet. Tense your calves, relax your calves, and go all the way up again. I do this exercise myself when I'm going to bed, and 9 times out of 10, by the time I get to my tops of my legs, I am asleep. So I never make it to the end of the progressive muscle relaxation. I'm always asleep before I can finish it. So another great exercise is called guided imagery. So again, as we go through many of these different interventions, one thing is going to maybe scream out to you as something that you would be interested in doing and practicing. So what's good for one person is not necessarily good for another, and vice versa. Guided imagery is really helpful for visual people, but it can also be helpful for people who are not visual. They can pretend that they are going through an exercise. I'm going to ask you at this moment, so you see the picture of the lemon, and if you're in a safe place where you don't need to be paying 100% attention, I'm going to ask you to maybe close your eyes and try and bring that picture of a lemon in your mind. Think about what the lemon looks like. If you were to pick it up, what does it feel like? If you were to bring it up to your nose, what does it smell like? If you were to take one of those lemon wedges and put it in your mouth, what does it taste like? Going through your mind with every different sense and how it would respond to an actual lemon. But in essence, you're imagining or pretending. So guided imagery is using your imagination. Children are really good at this. And I'm sure when you were a child, you were pretty good at this. And as we get older, we forget how to pretend and how to imagine. So I challenge you over the next couple of days, pick something, a place, a person, a thing that brings you joy or makes you happy. You know, if you think about it, what's going to bring some joy into your inner self? And that is what you are going to start trying to imagine and bring that image to your mind. So in imagery, a natural thought process uses one or more of the 5 senses, and it really helps that right brain thinking part of the body. So that's where we're creative. And it is a bridge between the conscious and the subconscious mind. And sometimes people will say, oh, I can't imagine. But I do want to point out, if you can worry about something, if you've had a sense of worry about anything, if you can worry, you can imagine. because worry is our brains imagining what may happen in the future. So if you can worry about something, imagery can be a very powerful tool because it allows us to replace that negative worrying with something positive. It allows us to think and be creative and envision or pretend that maybe we are someplace that makes us happy. Gratitude practice is extremely valuable. When we are expressing gratitude, it really brings a sense of a positive sense and a sense of calm to ourselves, and it allows us to look at things from a different perspective. So I challenge you right now, think about something or someone that you are grateful for. And even further than that, write it down. When we write things down, it really creates that sense of permanence. So thinking about what you're grateful for and then writing it down can be extremely powerful. Every day, think about something or someone that you are grateful for, write it down, and then even past that, I challenge you to share that gratitude with the person or whatever it is that you are grateful for. So if you are grateful for your health, you're grateful for something that you have done, say thank you to yourself, which is also important. And then share that sense of gratitude with other people as well. It is also equally as important to maintain a healthful diet. So our bodies require nutrients, our bodies require hydration, our bodies require certain things in order to function at their most ideal level. So when we are deciding on what to eat, when to eat, how to eat, remember that when we put things into our bodies, that it is providing nourishment to allow us to enhance our immune system. Certain foods can either increase or decrease inflammation in the body and can help us be resilient against a lot of the challenges that we may have. So I challenge you to be mindful of the foods that you are eating and to ensure that what you put into your body helps to support your overall health. The practice of journaling is another valuable tool. So often in life, our brains get very cluttered up with thoughts and worries and concerns. Being able to journal allows us to take information out of our mind and put it down on paper. This is extremely valuable when you're trying to sleep. So very often when we're trying to go to sleep, all the thoughts of the day are going through our mind, and it becomes extremely challenging to quiet our mind because that worry and that focus on those thoughts are really, that's the brain making sure that we don't forget about something. That's the brain making sure that we are able to address whatever it is that we're worried about. So it is extremely important that we give the brain an outlet to be able to do that. Another thing that is helpful is to set our goals and our priorities. So as we set our goals and our priorities for setting our goals and our priorities for what we need to do in order to decrease our stress and enhance our resilience, we want to know what is important, what must get done right now. So what's important, and perhaps maybe saying no to something that is maybe not as important, right? So looking at what is the most important and focusing on that. And then when things are not so important, maybe putting it off to the side, maybe writing it down in a journal and putting it off for a little bit later. But that can be extremely helpful. And then remember that we are all creatures of habit. So our body clock and overall well-being rely on daily routines to help in terms of sleeping and doing things that are so valuable. So the more times or the more often that we can devote to a routine, the better that we are going to be at excelling in these types of things. And remember that we are more alike than we are different. We're moving through this unknown together. And in times of hardship, these times really do create a greater sense of joy in the future. I know it's hard to think that way sometimes, but just knowing that this is not forever and that we are in this together. So we know that stress will always be with us, but knowing that moving forward, if we can do things to help mitigate that stress by continuing our self-care practices, that we can really enhance our lifelong journey to wellness. And I do urge you not to wait to talk to your healthcare provider to discuss stress, starting with the conversation and being sure that you get the proper healthcare for any existing or new healthcare problems is really the first step towards ensuring that your overall level of health is moving in a positive direction. I do have some resources. If you're interested in them, we can be sure to share them in the future. And I'll open it up if anyone has any questions.
Great. Thank you so much, Marie, for your presentation. That was great. We have about 5 minutes for Q&A. So like she said, if you do have any questions, please feel free to ask and we can get to as many as we can. So we have one here. I'm really afraid to drive due to extreme road rage nowadays. How do I overcome this type of stress? I was in a severe motor vehicle accident years ago caused by another person.
I am so sorry that you're going through that. That's must be very upsetting to you. If you feel like your stress is really inhibiting your ability to do daily activities, you know, being able to go to work or drive to go to the store, I would really urge you to talk to your primary provider about the stress. And in the meantime, start trying to work on maybe 1 or 2 stress reduction techniques to try and help you feel more calm and comfortable in the moment. But don't wait to talk to someone about a level of stress or anxiety that may be inhibiting your quality of life.
Perfect. We'll give it another minute or two just questions. But in the meantime, if you'd like to view more of our HealthyU webinars, they're on our website at matherhospital.org/HealthyU. A PhD in psychology has said that the old saying, trust your feelings, is wrong as it can lead to closed circuit through cycle. Is this true?
Could you repeat that one more time?
Yeah. You could actually click the Q&A too, if it might be easier for you to read.
Oh, okay.
I don't know.
So that's an interesting thought. You know, I do think that we need to learn to trust ourselves, but to a point where it's healthy. So if our feelings are telling us you know, many negative thoughts, or we feel that perhaps we get stuck in a negative cycle, then I think it's important to reach out to someone who can help us maybe sort out those feelings.
Okay, great. Looks like we're all set here. Marie, thank you so much for joining us today. You guys will be receiving an email with a link to complete a survey. If you could please fill that out, it helps us plan our future webinars. It actually looks like we've got one more here. How can I steer the daily work conversation about the virus, especially workers who think the virus isn't real? I find this very stressful.
So when people have different opinions, that is absolutely very stressful. We have to worry about, we can only deal with our own stress. So we cannot take on someone else's stress or someone else's anxiety. So advising people to explore the facts and go to reputable sources to get, the true stance on what's real, how to treat things, etc. But in terms of conversations that are stressful, we can only be responsible for our own thoughts and our own words. So we need to know that what we're saying is as truthful as we know the truth to be. And if something is making us uncomfortable, really learning to step away and just say no to not engaging in those types of conversations, and being able to recognize that sometimes conversations are not healthy when we're not able to share them in a collegial way.
Perfect. Do you recommend over-the-counter stress relief organic supplements?
I would talk to your primary care provider first, because I would never recommend something without knowing what your medical history is. And, if you're on medications or you have any other conditions, those always need to be taken into account before you put something else into your body.
How do we avoid unvaccinated friends, relatives who aren't vaccinated without hurting their feelings?
That's a very good question. I think being open and honest, because we are all human and we all have a right to our opinion. We all have a right to do what's right for us. And if things are explained in a calm and kind way, I think that's the best way to avoid hurt feelings.
Great. And then there's one more question here. I was hoping maybe you could take a look, because I'm not quite sure if it has to do with one of the resources you may have had up on the screen.
Oh, Veteran Administration. Yes. So VA is the Veterans Administration. So it's through the VA health system. The Veterans Administration health system.
Okay. What was the VA letter for the Google App Store?
Oh, CBT-I. So it's cognitive behavioral therapy for insomnia, CBT-I.
How is related stress with belly fat? Or I guess, how is stress related to belly fat? Probably.
Because it increases the cortisol in the body. So it impacts your hormones, and that in turn is more challenging. So if we have more cortisol, it makes us retain additional fat. So cortisol is the stress hormone. And when we are feeling more stressed, our body feels like it's in it has to go into a fight or flight response. And going way back to the cavemen days where we, did not have access to food, or we did not have access to a refrigerator to store food. If you were feeling stressed because the winter was coming, or you're feeling stressed because there was not enough food, your body would retain additional fat, to help get through those times when there was not, when there was not enough food to go around. So that's been that way for quite some time, that when we're stressed, we have an increase in cortisol, and that leads to more retaining of body fat.
Last question. Is grieving part of stress, and how?
Yes. So that is an excellent question. So when we are feeling stressed, so often we're stressed because we're grieving the loss of maybe what things were like before COVID hit. Maybe we're grieving someone that we lost because of COVID. So there's a lot of grieving that's been going on over the past year and a half. And when we feel that sadness can, can trigger a feeling of stress. So I definitely think that when we are grieving, we feel stress in a more negative way because overall we have a sense of sadness. And that makes it more challenging to mitigate any of the other stressors in our lives. So I do want to point out that if you are feeling an overwhelming sense of grief or sadness or loss, to really reach out to a resource, your primary care provider or some other resources that have been shared through the HealthyU seminar to try and help mitigate that.
All right, great. Thank you so much, Marie, for joining us today. And everybody, please enjoy the rest of your afternoon.
Thank you.